Hello guys, so in this video we want to talk about this disease which we all know. It is a respiratory disease that we want to explain and how it is transmitted into our flock. So all of us know it as a respiratory disease, which is cough and flu. So of course there is some antibiotics that will treat effectively this disease. So you have to know the right antibiotics to use to this flu, this disease, this respiratory disease. But we have to know, how does it come into our poultry? So this disease is caused by Mycoplasma gallisepticum. So it is a respiratory disease as we know it, and we know like when the birds are having difficulties in breathing, some are sneezing like what's they are making that sound. Some are having difficulty in breathing like birds are breathing like that. So we know like this is a flu. And you know, a lot of poultry farmers have tried several antibiotics trying to treat this disease. But if you are not sure of which right antibiotics to use on this disease, you can't treat it. And the fact is that this respiratory disease, which is caused by Mycoplasma gallisepticum, it's a disease which stays in your cheek for life, like the whole life of the cheek. You can't like treat it then it goes out for life, like it goes away. No, you can only suppress that disease using the right antibiotics, but that disease still stays in the system of the bird. So you have to know that. So we have to know, how does this disease comes into our poultry? So the fact is that this disease, since it stays in the system of the bird and it doesn't go away, so how does it come into our day-old chicks? It's not all the day-old chicks that will carry that disease. So, but most of the birds, they have that disease in them. So this disease is transferred from the parent stocks. The parent stock, if they had that disease, Mycoplasma disease, that disease can be transferred through the eggs. That means those chicks will have that disease. So these parent stocks have this disease in their system which cannot go away. It can only be suppressed. So when they are transferred to the birds, which means when you're getting your birds, of course you won't see the symptoms on the first days, because you know the birds are given some vaccine to suppress that disease if it's there. So now we have to know, how do we treat this disease? So we know, of course, like this disease can't go away from our poultry. We can only suppress it. So we have to know the right antibiotics to use. So the right antibiotics we can use for this type of a disease, we have to use the antibiotics which are calling tylosin on them, because tylosin is very effective on this disease. So tetracycline is also good for this kind of disease. This antibiotic is good, but most of the time we have to pay attention on the percentage of tylosin which is in that antibiotic, because tylosin is very, very effective to treat this respiratory disease. So you know, you have to use now on this point when you know like, okay, I know the disease, so you use like Tylodox, Doxin, Telmoxin, all these antibiotics. So you have to pay attention what content is in that antibiotic and what percentage are they having. So make sure you check how much percentage is tylosin in that antibiotic. So for example, you know, you can't just pick up an antibiotic which has high percentage on tylosin to treat this disease. So the fact is that you have to be mindful and you have to be tricky when treating this disease. You know, on day-old chicks, you can't use, for example, 75% tylosin on that antibiotic, because that disease, you know, it doesn't go away for good. What if it elapses again, it surfaces on your beds? Then you used the strongest antibiotic to treat that disease. Now if it becomes resistant to that disease, that means you have to look for 100% Tylosin to treat again that disease, because that medicine that you use that phase, it was strong, and they've become resistant to that. So you have to use knowledge, and you have to use a collect technique here. So a collect technique is that for your day-old chicks, which are maybe only weeks old, you use at least 20% of Tylosin, at least, just in case if that disease again comes into your flock, then you're able to jump into maybe 50% of Tylosin. Then when it elapses again, you are able to jump into 75%, which means with your broiler chicks, you are almost at the end of selling your beds, which is okay, because this disease can't be taken away for good. It can only be replaced by these antibiotics. So make sure when you are going to pick up your antibiotics, check how much percentage is there in the antibiotic, how much is the percentage of Tylosin. So like I've mentioned, day-old chicks, you can't use 75%. At least you have to go for lower percentage. So you have to make sure your flock is like the way I've mentioned it. You have to make sure you follow that guideline. Make sure you check for these. There are a lot of antibiotics, but make sure the one which is effective is the one having Tylosin, like I've mentioned. So guys, I'm sure you are aware how this disease comes into your poultry, and how you can treat it, and how to check up for the right antibiotic to treat this disease. So make sure you check for the right antibiotic according to the age of your beds. You use the right percentage of Tylosin in that antibiotic so that you can treat this disease. Just in case it surfaces again into your poultry, you are able to treat it accurately. So guys, I'm sure you've learned something out of this video, and you are able to know how you can treat your chicks. So the right antibiotics, you can use also tetracycline, like I've mentioned, doxin, Tylodox, very effective. These are antibiotics that you can use which are effective because they have Tylosin in them. Not any other antibiotics that they give you then you just accept. No, you need to know which disease am I treating. If it's flu and cough, make sure you choose an antibiotic which has got Tylosin in them. And then again, you need to check the percentage according to the age of your beds. You can't just pick the antibiotic with the highest. Of course we know, like, these antibiotics are in categories. There are percentages there. In case you didn't know, like, these antibiotics are in percentages, now you know. You need to make sure you check how much percentage is this kind of chemical which is in here to treat specifically on this disease. How much percentage is there? You need to make sure you check that. They are always written there on the contents of the chemicals which are in. You check the percentage, then you're like, okay, I'm getting the right percentage of the chemical that I need. So thank you guys for watching, and make sure you subscribe. And if you like the content, don't forget to like the video so that even others can benefit from this video, so that they'll be able to watch it and they'll be able to benefit from it. And so that when they're treating this disease, they can also be aware, like, okay, when I go to pick up the antibiotics, I need to pick up this kind of antibiotics. So make sure you like the video and make sure you subscribe so that you don't miss any content that we put in here, because the contents that we put in here, they are always beneficial to your poultry business. Thank you for watching, guys. Bye bye.